Cardiologists use contrast in the cath lab for a number of procedures, including PCI, CTO, CHIP, TAVR, and other structural heart interventions. Contrast is injected into the vessel through a catheter. Almost all contrast injected will find its way to the kidney. Contrast can significantly injure a patient's kidneys. It is directly toxic to kidney cells. One study found that 15 minutes of exposure caused 40% of these cells to die. Contrast directly impacts the nephron, the kidney's core functional unit, and its blood vessels. In the tubule of the nephron, the viscous contrast can clog up, increasing the contact time with kidney cells. This clogging also slows down the kidney's filtration rate. Contrast can cause injury by clogging up renal blood vessels, blocking oxygen delivery. Contrast-induced vasoconstriction and diuresis exacerbates these mechanisms. Chronic kidney disease further amplifies injury because these patients have fewer functioning nephrons to filter contrast, leaving remaining nephrons to face a higher concentration of contrast. This kidney injury increases a patient's risk of dialysis, major adverse cardiac events, and mortality. RenalGuard is designed to protect patients from acute kidney injury. The RenalGuard system measures the patient's urine output in real time and automatically infuses an equal volume of hydration fluid to maintain the patient's fluid level. RenalGuard therapy starts an hour before the procedure with a small bolus of saline to make sure the patient is hydrated. At the same time, the RenalGuard system begins fluid matching. Prior to contrast exposure, the patient receives an IV diuretic injection. This combination of diuretic with matched fluid drives very high urine output, even in patients with poor kidney function. RenalGuard therapy's high urine flow is designed to protect the kidney in a number of ways. First, it can dilute contrast passing through the kidney and may reduce the contact time with kidney cells, reducing the impact of contrast's toxicity. It may reduce oxidative demands on kidney cells and prevent vasoconstriction and dehydration, protecting the kidney from reduced oxygen delivery. Together, these mechanisms are designed to move contrast out of the kidney faster and combat its negative effects. Innovations in interventional cardiology will continue to bring sicker patients into the cath lab. These patients will require all of the protection we can give them from the negative impacts of iodinated contrast. RenalGuard provides that protection. RenalGuard. Prevent AKI.